Introduction to reproductive medicine. What is reproductive medicine? Reproductive medicine is a branch of medicine that focuses on the diagnosis, treatment, and management of conditions related to the reproductive system, particularly in individuals or couples facing infertility, reproductive health issues, or other concerns related to sexual and reproductive health. It involves the study and treatment of disorders related to the male and female reproductive systems, pregnancy, and hormonal balance. Reproductive medicine covers a wide range of medical specialties, including gynecology, endocrinology, urology, andrology, and genetics. Key areas within reproductive medicine include: first, infertility treatment, diagnosis of infertility, understanding the causes of infertility in both men and women, e.g., ovulation disorders, sperm quality, tubal blockages, etc. Assisted reproductive technologies, ART. These include techniques like in vitro fertilization, IVF, intrauterine insemination, IUI, egg freezing, and sperm donation, aimed at helping couples conceive when natural conception is not possible. Second, hormonal disorders. Endocrine dysfunction. Reproductive medicine addresses hormonal imbalances that affect the menstrual cycle, ovulation, and sperm production. Conditions like polycystic ovary syndrome, PCOS, and hypothyroidism are treated to restore fertility. Menopause management. Treatment for symptoms associated with menopause, including hormone replacement therapy, HRT, is also part of reproductive medicine. 3. Fertility preservation, egg and sperm freezing. Reproductive medicine includes counseling and medical procedures for fertility preservation in cases like cancer treatment, advancing age, or medical conditions that affect fertility. Embryo freezing, a process for couples undergoing IVF, where embryos are stored for future use. Fourth, prenatal care and genetic counseling. Preconception care, preparing individuals for pregnancy through health assessments, lifestyle counseling, and genetic screening. Genetic testing involves screening for genetic disorders that may affect reproduction or the fetus, such as chromosomal abnormalities, and offering treatments like pre-implantation, genetic testing, PGT, during IVF. 5. Men's reproductive health. Male infertility treatment involves diagnosing and treating male infertility factors like low sperm count, erectile dysfunction, or hormonal imbalances. Andrology, the medical specialty focused on male reproductive health, including conditions like erectile dysfunction, varicocele, and testicular issues. 6. Reproductive surgery. Surgical procedures. These may include laparoscopy for ovarian cysts, tubal blockages, or endometriosis, hysteroscopy for uterine problems, and microsurgery to treat male infertility. 7. Sexual health. Addressing sexual dysfunction, libido issues, and other aspects of reproductive and sexual health that may impact fertility or quality of life. 8. Menstrual disorders. Treatment of abnormal menstrual cycles, heavy bleeding, and conditions like dysmenorrhea, painful periods, and amenorrhea, absence of periods. Reproductive medicine involves an interdisciplinary approach, often combining the expertise of gynecologists, endocrinologists, urologists, fertility specialists, and psychologists to manage the emotional and psychological aspects of reproductive health and fertility challenges. The goal is to enhance reproductive health, prevent reproductive disorders, and provide medical solutions for those struggling to conceive or maintain pregnancy. Definition of reproductive medicine. Reproductive medicine is a specialized branch of medicine that deals with the study, diagnosis, and treatment of reproductive health issues in both men and women, particularly infertility and other disorders of the reproductive system. It encompasses a variety of medical and surgical treatments, including assisted reproductive technologies, ART, hormonal therapies, and surgical procedures aimed at helping individuals or couples achieve a healthy pregnancy or address reproductive health problems. The field combines several disciplines, including gynecology, endocrinology, urology, andrology, genetics, and obstetrics. Reproductive medicine is critical for treating issues related to conception, pregnancy, fertility preservation, and sexual and reproductive health, as well as offering solutions for conditions such as polycystic ovary syndrome, PCOS, endometriosis, male infertility, and menopause. Scope of reproductive medicine. The scope of reproductive medicine is broad and covers a variety of topics and treatments, including the following: infertility and assisted reproductive technologies, ART, diagnosis of infertility, identifying the causes of infertility in men and women, e.g., ovulatory dysfunction, sperm abnormalities, tubal blockages, or unexplained infertility. In vitro fertilization, IVF, a technique where eggs are fertilized outside the body and the resulting embryos are implanted into the uterus. Intrauterine insemination, IUI, a procedure where sperm is directly inserted into the uterus around the time of ovulation. Egg and sperm donation, use of donor eggs or sperm in cases of male or female infertility. Embryo freezing and cryopreservation, preserving embryos for future use, often used in IVF cycles. Gamete intrafallopian transfer, GIFT, and zygote intrafallopian transfer, ZIFT, less commonly used ART procedures where fertilization takes place inside the body. Menstrual and hormonal disorders, polycystic ovary syndrome, PCOS, a condition that causes hormonal imbalances, often leading to infertility and its management. Endometriosis, a disorder where tissue similar to the uterine lining grows outside the uterus, causing pain and infertility. Amenorrhea, absence of menstrual periods, diagnosis and treatment of the absence of menstruation, either primary or secondary. Dysmenorrhea, painful periods, addressing menstrual pain often caused by conditions like endometriosis or fibroids. Male reproductive health, male infertility, diagnosing and treating conditions such as low sperm count, poor sperm motility, or erectile dysfunction. Sperm retrieval techniques, procedures like testicular sperm extraction, TESE, for men with low or no sperm production. Andrology, a subspecialty focused on male reproductive health, including the treatment of erectile dysfunction, varicocele, and male infertility. Reproductive surgery, tubal surgery, surgical treatments for blocked fallopian tubes, which can prevent conception. Myomectomy, surgical removal of uterine fibroids that can interfere with conception or pregnancy, hysteroscopy and laparoscopy, minimally invasive procedures used to diagnose and treat issues like fibroids, endometriosis, and uterine abnormalities, vasectomy and reversal, surgical procedures related to male sterilization and its reversal, genetic counseling and testing, pre-implantation genetic testing, PGT, testing embryos for genetic disorders before implantation during IVF cycles, carrier screening, screening potential parents for genetic conditions that may be passed on to their children, genetic counseling, providing guidance for individuals or couples regarding their genetic risks and reproductive options, fertility preservation, egg freezing, oocyte cryopreservation, preserving a woman's eggs for future use, particularly in the case of medical conditions, e.g., cancer or advanced age, sperm freezing, sperm cryopreservation, storing sperm for future use, especially in men undergoing cancer treatment or other conditions that might affect fertility, embryo cryopreservation, freezing embryos after IVF for future implantation, reproductive endocrinology, hormonal imbalances, treatment of hormonal conditions affecting the reproductive system, such as thyroid dysfunction or adrenal disorders, management of menopause, hormone replacement therapy, HRT, and other treatments to manage symptoms of menopause and reduce the risk of osteoporosis, polycystic ovary syndrome, PCOS, and ovulatory disorders, treatment of anovulation and disorders affecting the female reproductive endocrine system, sexual and reproductive health, sexual dysfunction, addressing issues related to libido, arousal, or orgasm, which can affect fertility, contraception, counseling and management, providing information and medical interventions for both permanent and temporary contraception methods, pre-conception, counseling, preparing individuals or couples for pregnancy through lifestyle counseling and health assessments, pregnancy care, preconception, care, preparing a woman's body for pregnancy through nutritional sashimi, medical and lifestyle changes, early pregnancy monitoring, monitoring of early pregnancy for complications such as ectopic pregnancy or miscarriage, ethical, psychological, and social aspects, counseling. Fertility challenges often carry psychological and emotional burdens. Counseling is an essential component of reproductive medicine to support individuals and couples. Ethics in reproductive medicine, navigating ethical issues such as the use of donor gametes, surrogacy, and the manipulation of embryos. Conclusion: reproductive medicine is a dynamic and multidisciplinary field that addresses the medical, emotional, and ethical aspects of reproduction and fertility. It provides critical services for individuals facing infertility, reproductive health issues, or those seeking to preserve fertility. The scope is continually expanding with advancements in assisted reproductive technologies, genetic testing, and hormonal therapies. The goal of reproductive medicine is to help individuals and couples build families, overcome reproductive health challenges, and ensure healthy pregnancies and births.